Be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or seen in this video. Introduction: Tuberculosis, TB, is a contagious bacterial infection caused by Mycobacterium tuberculosis. It primarily affects the lungs but can also target other parts of the body. TB has been a major public health concern for centuries, but with advancements in medical science, effective therapies have been developed. This video explores the basic principles of TB therapy, emphasizing the importance of a comprehensive approach to treatment. 1. Diagnosis and drug sensitivity testing. Accurate diagnosis of TB is the first step in initiating appropriate therapy. This typically involves a combination of clinical assessment, radiological findings, and laboratory tests such as sputum microscopy, culture, and molecular techniques. In some cases, drug sensitivity testing is essential to determine which antibiotics the bacteria are susceptible to, as drug-resistant strains of TB have emerged. 2. Directly observed therapy, DOT. TB therapy often involves a combination of several antibiotics over an extended period, usually 6 to 9 months. To ensure adherence to the treatment regimen and prevent the development of drug-resistant strains, directly observed therapy, DOT, is commonly employed. This approach involves healthcare providers or trained individuals observing patients as they take their medications, thus enhancing treatment success rates. 3. First-line and second-line drugs. TB therapy utilizes a combination of first-line and, in cases of drug-resistant TB, second-line drugs. First-line drugs include isoniazid, rifampicin, ethambutol, and pyrazinamide. These drugs are effective against most TB strains and form the core of the initial treatment regimen. Second-line drugs are used when drug resistance is identified and include medications like fluoroquinolones and injectable antibiotics. 4. Combination therapy. TB therapy relies on a combination of drugs to target the bacteria more effectively. This is crucial to prevent the development of drug resistance. The combination of drugs reduces the likelihood of bacteria surviving and multiplying in the presence of a single drug. 5. Treatment phases. TB therapy is typically divided into 2 phases, the intensive phase and the continuation phase. During the intensive phase, which lasts for about 2 months, a combination of first-line drugs is administered to rapidly reduce the bacterial load. The continuation phase, lasting around 4 to 7 months, involves a continuation of treatment to ensure the complete eradication of the bacteria. 6. Monitoring and adverse effects. Regular monitoring of patients is essential to assess treatment progress and manage any adverse effects of the medications. Some common side effects include hepatotoxicity, liver damage, peripheral neuropathy, and gastrointestinal disturbances. Monitoring can also help detect treatment failure or the emergence of drug resistance, necessitating adjustments to the treatment plan. 7. Patient education and support. Educating patients about the importance of adherence to the treatment regimen, as well as potential side effects and the overall course of treatment, plays a pivotal role in the success of TB therapy. Patients need to understand the consequences of non-adherence, which can lead to treatment failure, disease relapse, and the development of drug resistance. Conclusion: tuberculosis remains a global health challenge, but through the application of these basic principles of therapy, significant progress has been made in controlling and treating the disease. Early diagnosis, adherence to treatment regimens, and a comprehensive approach that addresses monitoring, education, and support are crucial for the successful management of TB. As research continues and healthcare systems strengthen, the hope is that TB will become increasingly manageable and, eventually, a disease of the past. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale. Message them on Instagram at Coffee First Cup to receive generous discount codes. That's a wrap for today's lesson. I hope you found this video informative and helpful. If you have any questions or topics you'd like me to cover, let me know in the comments below. Don't forget to like and subscribe to my channel for more educational content. Take care, keep studying, and I'll catch you in the next video. Bye.